In today's very busy health environment, signs and protocols are posted everywhere. Hundreds of seminars and trainings were conducted about this infection prevention and control. But why is it important and why should we care? COVID-19 is a very serious disease and it is still attacking us physically, mentally, and economically. This virus was first detected on Wuhan City, China on December 2019 and is now transmitted in different countries all over the world. The current evidence suggests that transmission of SARS-CoV-2 happens between people through direct, indirect, or close contact with the infected people. When an infected person coughs, sneezes, talks, or sings, infected and respiratory secretions such as saliva and droplets carry the virus that could also infect others. The World Health Organization reported 111 million infected cases and 2.4 million are reported dead as of February 2021. We can see that in this very short period of time, the virus reaches worldwide and became pronounced as pandemic. The WHO released a standardized protocol and guidelines that help prevent and control the spread of the virus. A simple hand washing, social distancing, and wearing PPE such as face masks and face shields are the few ways to protect the public and individuals. They also provided additional and necessary guidelines and protocols intended specially for healthcare providers during the clinical area. The minimum infection prevention practices, or known to be the standard precautions, are applied to all patient care regardless of suspected or confirmed infection status of the patient and in any setting where the healthcare is delivered. These practices are designed to both protect healthcare workers and prevent them from spreading infections among patients. Standard precautions include hand hygiene, use of personal protective equipment, respiratory hygiene or cough etiquette, sharp safety, safe injection practices, sterile instruments and devices, and clean and disinfected environmental surfaces. Now, just for a quick background about sharp safety. In 1999, the NIOSH, or National Institute for Occupational Safety and Health, published a study on preventing needle stick injury in healthcare setting. They found out that the majority of needle stick injuries were preventable. This led to the Needle Stick Safety and Prevention Act that went into effect in April 2001. Additionally, the Occupational Safety and Health Administration, or OSHA, publishes and enforces regulations to protect healthcare workers from occupational injuries. Now, going back to the standard precautions, when they alone can no longer prevent transmission, they are supplemented with transmission-based precautions, which includes restrictions of susceptible healthcare personnel from entering the room and limiting transport and movement of the patient. The second line of infection prevention is used when patients have diseases that can spread through contact, droplets, or airborne routes, like the present transmitted SARS-CoV-2 or COVID-19. TPB are always used in addition to standard precautions. Avoiding carelessness in the clinical area is also a must in preventing and controlling infections. If an injury has been verified from the carelessness of a medical caretaker's activities, it will be accounted to him and a lawful judgment will be placed upon him. But it will not only affect the healthcare worker himself, because the one who gets injured can be infected in any possible diseases and will also affect the safety and trust for the healthcare facility or the hospital. The safety and trust will largely be affected because many will no longer listen to the healthcare professionals once they committed a mistake that would cost a life of an individual. Another reason why it is very important for the healthcare worker to prevent and control infections is simply because of life. In a very busy healthcare environment, you, your patient, and even their visitors are frequently at risk of exposure to pathogenic and evolving germs, contaminants, and other microorganisms. Nurses, doctors, and any other healthcare providers continue to educate themselves in terms of infection control because they know how could an infection cost someone's life. A study published by the medical journal The Lancet has revealed that sepsis is one of the leading causes of deaths in the hospitals, which accounts for 1 in 5 deaths globally. But what exactly is the sepsis? Sepsis is the body's extreme response to an infection. It is a life-threatening medical emergency. Happens when an infection you already have triggers a chain reaction throughout your body. It can rapidly damage body tissues, fail organs, and even death if not treated immediately. This is the reason why sepsis is the most common cause of deaths in the hospital in the US. Lastly, the infections control is very important for the healthcare workers because it will not only prevent the spread of the infection but also a necessity in the medical studies and improvements. If the infection is controlled, the healthcare workers and researchers will be able to study the virus, bacteria, or any other microorganisms without even contaminating themselves. This will help them do their jobs easily and effectively. Now, that's all for the importance of infections, preventions, and control for the healthcare workers. And as always, stay healthy, happy, and educated. Have a good day, everyone.